10 popular medications that could lead to dementia. Did you know that certain commonly used medications could raise your risk of developing dementia? Have you ever considered that your daily pill might be affecting your cognitive health? This video presents eye-opening information about 10 popular medications that recent studies have linked to the development of dementia. Discover which medications are involved, learn about the potential dangers, and find out about safer alternatives for treating conditions like anxiety, insomnia, depression, and chronic pain. Get ready for an informative video that may change the way you manage your medical treatment and protect your mental health. Stay with us until the end, as medication number N is the most dangerous, and many people use it unknowingly. You'll be surprised. Medication 1. Benzodiazepines. Benzodiazepines, including diazepam and lorazepam, are widely prescribed to treat anxiety, insomnia, and other stress-related disorders. These drugs work on the central nervous system by enhancing the action of the neurotransmitter GABA, providing a calming effect. While they can effectively relieve acute symptoms, prolonged use of benzodiazepines carries significant risks for cognitive health. Recent studies suggest that long-term use of these medications is linked to a higher risk of developing dementia. It is believed that these drugs may interfere with brain function, impairing memory and other cognitive processes. Additionally, physical and psychological dependence can develop, making it difficult to stop taking these medications without medical supervision. For example, a French study that followed over 1,000 elderly people for 15 years found that those who used benzodiazepines regularly had a 60% higher risk of dementia compared to those who didn't. These findings highlight the importance of reconsidering the use of such medications, especially among older adults who are more vulnerable to side effects. If you or someone you know uses benzodiazepines, it's crucial to discuss these risks with a healthcare professional. Safer therapeutic alternatives, like cognitive behavioral therapy, can effectively treat anxiety and insomnia without the same dementia-related risks. Transitioning to these alternatives should be done carefully and under medical supervision to avoid withdrawal symptoms and ensure treatment remains effective. Medication 2. Anticholinergics. Anticholinergics are used to treat various conditions, including allergies, urinary incontinence, Parkinson's disease, and common cold symptoms. Well-known examples include diphenhydramine, Benadryl, and oxybutynin. These medications block the action of acetylcholine, a neurotransmitter important for memory and muscle function. Although effective, prolonged use of anticholinergics has been associated with an increased risk of dementia. Acetylcholine plays a key role in cognitive function, so inhibiting it over time can lead to cognitive decline. A study by the University of Washington, which followed over 3,400 adults for more than 7 years, revealed that regular users of anticholinergics faced a significantly higher risk of dementia, especially with high doses over extended periods. These findings are alarming considering the common use of over-the-counter drugs like antihistamines. It's essential for individuals, especially the elderly, to be aware of these risks and seek safer alternatives when possible. For example, nasal corticosteroids can effectively treat allergies without the cognitive risks associated with anticholinergics. If you take anticholinergics regularly, discussing the potential dangers with your doctor and exploring other treatment options is important. Medication 3. Tricyclic antidepressants. Tricyclic antidepressants, such as amitriptyline and imipramine, are used to treat depression and some chronic pain conditions. These medications work by increasing the levels of neurotransmitters like serotonin and norepinephrine in the brain, which improves mood and reduces pain. However, despite their effectiveness, tricyclic antidepressants come with side effects, including a higher risk of cognitive impairment. Their anticholinergic activity can interfere with acetylcholine, a neurotransmitter crucial for memory and learning. Over time, this can contribute to cognitive decline. A major study by Indiana University, which analyzed data from over 400,000 patients, found a clear link between prolonged use of tricyclic antidepressants and an increased risk of dementia, especially with high doses or long-term use. If you are taking these medications, it's crucial to talk to your doctor about potential risks. Other types of antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, may be safer options as they do not carry the same anticholinergic effects. Switching to these alternatives should be done under medical supervision to ensure continued treatment effectiveness and minimize side effects. Depression and chronic pain are serious conditions that require appropriate treatment, so do not stop taking prescribed medications without consulting your doctor. Instead, work with them to find the safest and most effective treatment for your condition. Medication for antipsychotics. Antipsychotic medications such as haloperidol and risperidone are prescribed for severe mental disorders like schizophrenia and bipolar disorder. These medications work by altering the effects of neurotransmitters in the brain, helping to control symptoms such as hallucinations and delusions. However, prolonged use of antipsychotics has been associated with an increased risk of dementia. Studies suggest that these medications can cause significant side effects in the brain, including changes in brain structure and function, which may lead to cognitive decline. A study published in the British Medical Journal found that elderly patients treated with antipsychotics had a higher risk of developing dementia, with accelerated cognitive deterioration. Additionally, antipsychotics can cause severe side effects, such as excessive sedation, tremors, weight gain, and diabetes, which can further complicate treatment and affect overall health. For patients who need antipsychotics, it's essential to have regular medical monitoring to manage side effects and adjust dosages as needed. In some cases, it may be possible to reduce the dose or switch to a different medication that has a lesser impact on cognitive function. Medication 5. H2 receptor blockers. H2 receptor blockers, such as ranitidine and famotidine, are commonly used to treat gastric conditions, including acid reflux and peptic ulcers. These medications work by reducing the amount of acid produced in the stomach, relieving heartburn symptoms, and preventing damage to the gastrointestinal tract. However, recent research indicates that long-term use of H2 receptor blockers may have negative effects on cognitive health. It is believed that prolonged suppression of stomach acid can affect the absorption of essential nutrients for brain health, such as vitamin B12. Some studies also suggest that these medications may directly interfere with brain neurotransmitters, leading to cognitive decline. A study published in the Journal of the American Geriatric Society found that elderly individuals who regularly used H2 receptor blockers had a higher risk of developing dementia. Because of these findings, it's important to monitor the use of these medications, particularly in older patients. Other treatment options, such as proton pump inhibitors, PPIs, or lifestyle changes, may be equally effective without the same cognitive risks. Transitioning to these alternatives should be done with medical guidance to ensure the continued effectiveness of treatment and minimize potential side effects. Medication 6. Antiepileptics. Antiepileptic drugs, such as phenytoin and valproic acid, are essential for controlling seizures in epilepsy patients. These medications work by stabilizing electrical activity in the brain, preventing seizures and improving patients' quality of life. Despite their effectiveness, long-term use of antiepileptics has been linked to cognitive impairment. These medications can affect memory and other cognitive functions, as they may interfere with neurotransmitter activity and impair communication between brain cells. Additionally, many antiepileptics have a sedative effect, which can cause drowsiness and concentration difficulties, further worsening cognitive problems. A study published in the journal Neurology analyzed data from epilepsy patients and found a clear connection between prolonged use of antiepileptic drugs and cognitive decline. The risk was higher for patients taking high doses over extended periods. If you are taking antiepileptics, it's essential to discuss potential risks with your doctor. There are newer treatment options and combination therapies that may be less harmful to cognitive function. The dosage of antiepileptics should also be carefully adjusted to minimize side effects while ensuring effective seizure control. Medication 7. Statins. Statins, such as atorvastatin and simvastatin, are commonly prescribed to reduce cholesterol levels and prevent cardiovascular diseases. These medications work by inhibiting an enzyme involved in cholesterol production, helping to lower the risk of heart attacks and strokes. However, there are growing concerns about the effects of statins on cognitive health. Research on this issue has produced mixed results. While some studies suggest that statins might protect against dementia, others indicate that these drugs could increase the risk of cognitive problems. One theory is that statins may interfere with the synthesis of coenzyme Q10, a compound crucial for energy production in brain cells, potentially leading to cognitive decline. A study published in the Journal of Lipid Research found a possible link between prolonged statin use and an increase in dementia cases. Given these findings, it's important for patients on statins to discuss the potential cognitive risks with their doctors. Alternatives for managing cholesterol include lifestyle changes, such as dietary adjustments and exercise, as well as other medications that may have less impact on cognitive health. Decisions regarding statin use should be made based on a careful evaluation of both the cardiovascular benefits and the potential cognitive risks for each individual. Medication 8. Proton pump inhibitors. Proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, are used to treat gastric conditions like acid reflux and peptic ulcers. These medications reduce stomach acid production, providing relief from symptoms and preventing damage to the digestive system. However, recent research indicates that long-term use of PPIs may have adverse effects on cognitive health. Studies suggest that PPIs can interfere with the absorption of essential nutrients, such as vitamin B12 and magnesium, which are critical for brain function. A deficiency in these nutrients can lead to cognitive problems and increase the risk of dementia. Additionally, some researchers believe that PPIs might directly affect brain function, although the exact mechanisms remain unclear. A study published in JAMA Neurology found an association between prolonged PPI use and a higher risk of dementia, particularly among elderly patients. Because of these risks, it's essential to use PPIs cautiously and consider safer alternatives, such as dietary changes, less potent antacids, or natural treatments. If you regularly use PPIs, discuss the potential cognitive risks with your doctor and explore other treatment options. Transitioning to alternative therapies should be done under medical supervision to ensure safety and effectiveness. Medication 9. Opioid painkillers. Opioid painkillers, including morphine and oxycodone, are often prescribed for severe pain management, especially after surgeries or for patients with chronic conditions. These medications work by binding to specific receptors in the brain and spinal cord, providing powerful pain relief. However, beyond the risk of dependence, prolonged opioid use has been linked to negative effects on cognitive health. Studies show that opioids can cause structural changes in the brain, such as a reduction in gray matter volume in areas associated with memory and decision-making. These changes can lead to cognitive decline and increase the risk of dementia over time. Moreover, the sedative effects of opioids can contribute to drowsiness and concentration difficulties, worsening cognitive issues. A study published in Annals of Internal Medicine followed long-term opioid users and found a significant correlation between prolonged use and an increased risk of dementia. Given these findings, doctors should carefully assess the risks and benefits of opioid treatment, particularly for elderly patients. If you are taking opioid painkillers, it's crucial to discuss the potential cognitive risks with your doctor. Non-pharmacological therapies, less potent medications, or interventional treatments may be viable alternatives that pose fewer risks to cognitive health. Medication 10. Hormonal contraceptives. Hormonal contraceptives, especially combined formulations that contain estrogen and progesterone, are widely used for birth control and to treat conditions such as menstrual irregularities and acne. While these medications are effective and convenient, there are concerns about their potential impact on cognitive health, particularly with long-term use. Sex hormones, including estrogen and progesterone, played a key role in neuroprotection and cognitive function. Altering their levels through hormonal contraceptives can potentially affect memory and other brain functions. Some studies have suggested that prolonged use of hormonal contraceptives may be linked to cognitive decline and a higher risk of dementia. For example, a study published in the Journal of Women's Health followed women who used hormonal contraceptives for long periods and found a slight decrease in cognitive function. While the results are not definitive, they highlight the need for more research on the impact of hormonal contraceptives on the brain. If you are using hormonal contraceptives, it's important to discuss any potential risks with your doctor. Non-hormonal birth control options, such as intrauterine devices, IUDs, barrier methods, or natural options, might be less harmful to cognitive function. Decisions regarding contraceptive use should be made based on a careful evaluation of the risks and benefits for each individual. Thank you very much, friends, for watching our video to the end. Like it and please subscribe to our channel. This way we will understand that we are making useful videos. Also, please write in the comments what else you would like to know. All the best to you. See you in the next videos. Thank you very much, friends, for watching our video to the end. Like it and please subscribe to our channel. This way we will understand that we are making useful videos. Also, please write in the comments what else you would like to know. All the best to you. See you in the next videos.